my hair doesn't hurt and my toenails don't hurt and everything in between does. It's where do I not hurt?
The pain would be if my son were to just touch me, which he said he touched me very lightly, that it would feel like someone had grabbed me where I'd been bruised.
It's stabbing pains. I get stabbing pains different places. I'll feel like I have like stiff joints, kind of like sometimes arthritic pain, like even the joints of my toes will hurt.
It's like having the flu that never goes away. It's like every muscle in your body aches. And the problem with the pain is it's constant.
I thought I was having strokes. I wasn't sure what was going on, but I knew for 3 weeks I didn't rest. I was in severe pain and it was horrible. And I think they did every test on me that's known to man.
Chronic widespread pain has been part of humanity's existence from time immemorial. For several centuries it was known as rheumatism. In 1904, Sir William Gowers theorized that the pain from what he called fibrositis resulted from widespread inflammatory nodules in the soft tissues of the muscles and ligaments. Subsequent tissue analysis failed to demonstrate such changes, and in fact, to date, no pathology has been found in the muscles, bones, or joints that might convincingly be linked to the symptoms of chronic widespread pain. In 1972, Dr. Henry Smythe took significant steps toward our current understanding of fibromyalgia when he identified certain tender points inherent in widespread pain. Using Smythe's tender points, Dr. Harvey Moldovsky conducted the first electroencephalogram study. Moldovsky's study demonstrated an anomalous sleep pattern on brain scans that he labeled alpha-delta sleep. Moldovsky's report, published in the Journal of Psychosomatic Medicine in 1975, essentially began the current scientific interest in the disorder. In 1990, the American College of Rheumatology published the first official diagnostic criteria for the disorder. The committee determined that a diagnosis of fibromyalgia would depend on the presence of all of the following: widespread pain of at least 3 months duration, defined as pain on the right and left sides of the body, pain above and below the waist, including shoulder and buttock pain, pain in the distribution of the axial skeleton, including cervical, thoracic and lumbar spine, and anterior chest wall. The diagnosis also depends on the presence of tenderness to palpation with a force of 4 kilograms at 11 of 18 discrete areas, known as tender points. As the definition provided by the American College of Rheumatology suggests, fibromyalgia has traditionally been considered a rheumatological disorder involving the muscles and soft connective tissues, which seems natural given that the pain a patient experiences is felt in these areas. But there is more to fibromyalgia than the experience of widespread pain.
I will say sometimes I'm having a fibromyalgia moment or a fibro moment when I'm trying to say something or get something out or get an idea across. My mind knows what I'm trying to say, but by the time it gets from here to here, it doesn't come out right.
My best time of the day is in the evening. I want to do things in the evening. In the mornings, it's kind of like, don't bother me. It's kind of like a switch, like my biological clock is upside down.
I've had to resign myself to, at work, to let younger people do what I used to do, you know, and to give up on some of those types of things, and also to be very critical about what I do as far as extracurricular activities.
I remember many, many nights that my family would be up talking, and they would begin to get excited or talking about their day with their father or with each other, and I couldn't sleep. And I would get up out of the bed and I'd come yelling in there, I'm not getting any sleep, you're keeping me awake. I was so sensitive to the sound.
I ended up leaving my job at the bank because I was not only hurting, but I was having a lot of cognitive problems. And that was very hard for me to take because that was something I've never had a problem with. Whatever I wanted to learn, whatever I wanted to read, I could comprehend it.
You asked about the pain and I told you physical pain, but I think you can see that the hurt is really deeper because I've seen the death of dreams and aspirations and achievements, and the disappointment from that, because I had this so young and was not really able to achieve what I wanted to in life.
Historically, the absence of demonstrable pathology in the areas in which patients complain of pain has led many to dismiss the reality of fibromyalgia. In other words, because caregivers have been unable to find anything in the muscles, bones, or joints to explain the pain patients express, many have become frustrated, leading to stigmatization of patients and creating tension between patients and caregivers.
5 years ago, even when you would talk to doctors, they oftentimes did not want to talk to or even think about the fibromyalgia patient. Just a few weeks ago, we were at the American Academy of Family Physicians, and every physician who came by asked us for our magazine, asked us for information, and said, I desperately need help in how to help these patients. I think that there is a major change that is going on within the medical community. I think that they are slowly but surely understanding that this is something that they're not going to have go, it's not going away, because these patients are there, they have real symptoms, they have real needs. And I think what they're now interested in, instead of disputing it, they're more interested in having treatments and being able to help these patients.
As the search for an explanation for the symptoms in the muscles and joints has proven to be a fruitless endeavor, researchers have increasingly focused on changes in the central nervous system, the brain and spinal cord, as a potential source of the problem. Dr. Patrick Wood, an assistant professor at Louisiana State University Health Sciences Center in Shreveport, is a researcher whose work is focused on changes in the brain that might explain the symptoms of fibromyalgia. He is the originator of the dopamine theory of fibromyalgia and has used such advanced imaging technologies as positron emission tomography and magnetic resonance spectroscopy to investigate fundamental changes within the central nervous system that might result in the development of fibromyalgia.
With the advent of new brain imaging techniques, a whole new picture has emerged. As it turns out, we've simply been looking in the wrong place.
Based on recent research, the conclusion has been reached that what fibromyalgia represents is a change in the function of the brain and spinal cord, a form of what medical science calls central sensitization. The question that then naturally arises is what caused the change in the manner in which the central nervous system functions? The answer may surprise you.
I first finally gave in to the fact that I have stress in my life after being a super mom, making sure the kids were everywhere when they needed to be, then having Janine in a crisis situation, and then my mother who died from cancer, and then my father who lived with us with Alzheimer's, and at that same time being a principal.
I tell myself that stress isn't getting to me, but I still see the signs. I can't sleep at night. That gets worse. Can't wake up in the morning very well. Very tired. Usually my back and leg pain increase.
I have been under overwhelming stress, and I do good for the moment. While the stress is taking place, I'm fine, and I'm superwoman. I can handle it, but when it's over, it's like my body shuts down.
I was able to handle stress. I was able to juggle my life and going to school and working full time. So something that I'd been very proud of in being able to do, all of a sudden I found out I wasn't doing as well as I thought I was.
People with fibromyalgia oftentimes are people that have been caregivers, they're people that are type A personalities, they're people that have worked very hard in their lives, they're very intense people. And I think oftentimes they're people that try to do a lot of different things at one time. One of the things that's frustrating for people oftentimes is they used to multitask quite a bit. And I think that my generation has been put into a situation where we want to accomplish so much, we want to do so much, that maybe we've taxed our bodies too much, and some of the results are illnesses like fibromyalgia.
Multiple areas of the central nervous system are sensitive to the effects of stress, including the hippocampus, prefrontal cortex, and even the spinal cord. What intrigued Dr. Wood was that many of these same areas are involved in the processing of bodily sensation. In effect, a stress-related change in these areas might result in the type of sensitization that characterizes fibromyalgia.
A lot of people, I think, get offended by that idea that there may be a stress connection, as though to say, I'm not a weak person, I can handle stress. That misses the point. Basic science has demonstrated that the experience of chronic, prolonged stress produces very tangible changes in the brain, the central nervous system. People come to me and they say, well, it's just stress, or they say, well, my doctor said it was just stress, and they act like that's not a big deal. To me, that's like coming to me and saying, well, my house is on fire. It's not a big problem.
Using magnetic resonance spectroscopy to investigate the chemical composition of key brain structures, Dr. Wood and his colleagues uncovered subtle changes in the hippocampus and related brain areas that seem to confirm his prediction that stress-related changes likely play a critical role in fibromyalgia. Dr. Wood then predicted that patients with fibromyalgia would demonstrate significant differences in the manner in which their brains utilized a chemical called dopamine. Dr. Wood's predictions regarding dopamine were based on a number of critical observations. Fibromyalgia is associated with stress. Stress impairs the brain's ability to utilize dopamine. Dopamine plays a critical role in processing painful bodily sensations. In this illustration, waves of information from the body are represented in white as they travel up the spinal cord and enter the brain. The brain in turn uses dopamine in such areas as the thalamus, basal ganglia, and cingulate cortex to constantly filter the amount of information arriving from the body and spinal cord. The color blue represents the activity of dopamine. The fact is, we depend on this constant supply of dopamine just to feel comfortable in our own skins.
I like to tell my patients that God designed us to run away from tigers. And what I mean by that is that we're really well adapted to respond to acute stressors, short-term stressors that we can resolve or get beyond.
During times of acute stress, more dopamine is released. The purpose of this extra dopamine is to sharpen our ability to think and make rapid decisions, while at the same time numbing our bodies to painful sensations in order to allow us to escape from danger, thus increasing our chances of survival.
But when stress becomes chronic, going back to what we were saying about the changes that happen, when stress becomes chronic, this is when disastrous consequences occur. I like to say, going back to the tiger, we can run away from tigers. It's an entirely different thing to live locked in a cage with one.
As stress becomes chronic, the hormones released during stress cause an area of the brain called the hippocampus to become hyperactive. As a result of this hyperactivity, the hippocampus becomes atrophic, changing its chemical makeup and physically shrinking. Because the hippocampus also controls the amount of dopamine the brain stem releases, this hyperactivity decreases the amount of dopamine available to counteract the effects of pain. After periods of prolonged stress in the absence of dopamine, brain centers that dopamine normally soothes become hypersensitive to stimulation. As a consequence, more and more information from the spinal cord enters the brain unfiltered by the soothing effects of dopamine. We call this condition fibromyalgia. Following their demonstration of changes within the hippocampus, Dr. Wood and his colleagues conducted a study to investigate the brain's capacity to synthesize dopamine. What they discovered is that patients with fibromyalgia make significantly less dopamine in the very areas in which dopamine plays a critical role in pain processing. Practically speaking, the lack of dopamine that Dr. Wood predicted may serve as a reasonable explanation for a majority of symptoms from which fibromyalgia patients suffer.
In addition to its role in controlling the activity of dopamine-releasing neurons, the hippocampus is critically important to memory and learning. So a stress-related change in the function of the hippocampus may explain some of the cognitive problems that fibromyalgia patients complain of, difficulty with concentration or with short-term memory, what they typically call fibro fog. The hippocampus also controls the brain's stress response. Research has demonstrated that in fibromyalgia, those parts of the brain responsible for stress response, neurons that make a chemical called corticotropin-releasing hormone, and also the sympathetic nervous system, what people often refer to as the fight-or-flight system. Both of these systems are out of control in fibromyalgia.
At night, a healthy person's stress response system is dormant. This allows them to sleep deeply and awake feeling refreshed. In patients with fibromyalgia, the sympathetic nervous system or fight or flight system remains active, resulting in chronic insomnia. In effect, fibromyalgia patients lay awake at night, listening for the tiger. Fibromyalgia is a change in the way the brain listens to the body, resulting from a lack of normal dopamine.
If you're familiar with Parkinson's disease, then the idea that a lack of dopamine may be associated with fibromyalgia may be pretty scary. On the other hand, in Parkinson's disease, the neurons that are making dopamine are actually degenerating and dying. There's nothing to suggest that that's going on in fibromyalgia. Rather, I believe that in fibromyalgia, those neurons are underactive either as a result of genetic factors, as is thought to be the case in attention deficit disorder, or as the results of chronic stress, much the same as somebody dimming a light switch.
I very much believe that genetics do play a part in fibromyalgia. My grandmother was told that she had fibrositis, or she was told that she had rheumatism and all of these things. And I talk to people all the time, and we see that this illness does seem to run in families. And I would not be surprised at all if we find that there is a genetic predisposition to having fibromyalgia.
Future research will determine the role that genetic variations in such enzymes as aromatic amino acid decarboxylase and tyrosine hydroxylase, which the brain uses to make dopamine, might play in the disorder. Other possibilities include changes in the enzymes that determine dopamine's fate once it is released in the brain, or variations in the proteins to which dopamine binds, called dopamine receptors. The word fibromyalgia literally means pain in the muscles and fibrous tissues. But if the pain is really related to the central nervous system, then why is it called fibromyalgia? And why did it take so long to figure this out? Questions like these may be best answered by an analogy to another disorder, malaria. Because of where people contracted the illness, malaria was once thought to be caused by breathing in the fetid air that came from swamps. In fact, the word malaria literally means bad air. It wasn't until the invention of the microscope that scientists discovered the true cause of this deadly illness: tiny protozoans carried by mosquitoes that breed in those same swamps. Before the microscope, there was no way to see what was causing the illness. We have a new microscope. Rapidly developing technology is allowing us to see the brain in remarkable new ways.
First and foremost, the person owes it to themselves to identify those tigers in their lives, the things that are causing them stress. Now that may mean making some really hard decisions as far as lifestyle changes, but until you can get the stress out of your life, or at least reduce the stress, then you're probably not going to make very much progress. In addition, it's very, very important to maintain aerobic fitness. Now that may be very difficult when just moving can be painful for patients. So they need to start slow, but they need to continue going. It may require recruiting a trainer to help them out, or using resources like a warm water pool to do aerobics in. At a bare minimum, I suggest that patients walk between 15 and 30 minutes 3 times a week.
Unfortunately, as of right now, there are no medications approved of by the Food and Drug Administration specifically for the treatment of fibromyalgia. What that means, practically speaking, is that any prescription that a doctor writes to treat the symptoms of fibromyalgia is written off-label, and some healthcare providers are uncomfortable with that. However, if you have a provider that is willing to work with you, a comprehensive treatment program incorporating lifestyle changes, aerobic fitness, and yes, prescription medication can make a lot of difference.
My personal strategy in treating fibromyalgia is to listen very carefully to the patient's history and their experience of symptoms to try and understand what factors may be most important in influencing the way their brains work. And that may be things like norepinephrine, or what you might call brain adrenaline, or histamine, or estrogen in many women's cases. And then formulating a strategy that interferes with the activity or reduces the impact of those chemicals on their brain. I have the honor of running a fibromyalgia specialty clinic and using this insight that stress produces chemicals that affect the brain, and knowing that there's medicines that can change that impact, I've seen people get dramatically better. In fact, return to productivity.
An accomplished nurse with advanced degrees in psychiatric mental health nursing and psychology, Nancy Falk was familiar enough with fibromyalgia patients to know she did not want to be one of them.
I also had worked with people who had the diagnosis of fibromyalgia, and I knew that I'd not been as compassionate with those individuals because I viewed them as being whining women. And I didn't want to be a whining woman.
A car accident left her with a broken leg and a persistent pain in her neck. A pain that slowly spread throughout her entire body.
That was when I would get out of bed in the morning, and I'd not know how I was going to get up from the floor because I'd roll out, be on the floor, be on all fours, pull myself up, and then try to make it to the bathroom to get in the shower.
For Nancy, as unbearable as the pain got, it wasn't the worst part of her experience with fibromyalgia.
The worst part was the cognitive disorder that seemed to accompany it. I often felt like I couldn't find the words to express what I needed to say. I couldn't get organized. I felt very disorganized, whereas in the past I'd been extremely organized. I knew where everything was. I could remember things, and all of a sudden I couldn't. I couldn't remember as simple as had I called someone back and returned their phone call to tell them, give them information. And so it really was very destructive to my self-esteem, because I began to question whether or not I could function in my job any longer.
In the summer of 2003, Nancy took part in a study at Louisiana State University. Headed by Dr. Wood, the project was intended to determine whether changes to the hippocampus may be associated with fibromyalgia.
The purpose of the study initially my understanding was to actually measure the hippocampus and to determine if the right side, which seemed to be more affected in patients with fibromyalgia, had actually atrophied. And I came out of the exam understanding that, in a joking way, that I had brain damage. And so that was funny, to me.
Of all of the patients scanned, Nancy's hippocampus was among the most severely affected. Dr. Wood started Nancy on a regimen of prescription medications and over-the-counter supplements that seemed best suited for her needs.
The herbal therapies and medications that I took that were not necessarily any sort of formal treatment for fibromyalgia or what an individual might receive out in the community from a physician locally, those medications were given to me and they worked. It was amazing. I would increase the dosage on some. I tracked my symptoms. The most important thing was staying with the physician, keeping my appointments, taking the medicines as they were prescribed, calling if there was something that wasn't working, and seeing if there was something I could do differently.
As Nancy kept up with her treatment, she also began to introduce light exercise into her routine. Although extremely painful at first, Nancy began taking short walks. Over time, as she increased the distance of her walks incrementally, she noticed her energy returning. She was beginning to feel better.
About 9 or 10 months later, I was given the opportunity to be rescanned to see if there had been any change in the hippocampus in particular. And I wanted to do that because I was feeling so much better. I was more energetic, my thinking I had significantly cleared.
The results were remarkable. The changes in Nancy's right hippocampus had essentially normalized.
I actually get up in the mornings and stand upright, don't go on all fours. I can go and have a cup of coffee before I take a shower because I'm not hurting all over. I've been in my flower beds. I can mow the grass again. I can do the housework, but don't want to. I can cook, but don't tell my family. You know, I feel like doing things again.
Medication strategies that have proven the most benefit are those that promote the activity of dopamine in the brain. That may be medication that promotes the release of dopamine. Those are medications that can make the dopamine last longer once it's been released. Certain over-the-counter products are actually helpful to give your brain the fuel it needs to make the dopamine.
One such prescription medication that is having a tremendous impact in the world of fibromyalgia is a class of medications known as dopamine agonists. While presenting data on the treatment of restless leg syndrome in fibromyalgia patients, Dr. Andrew Holman, a Seattle, Washington area rheumatologist, had a serendipitous breakthrough.
While I'm there, I meet Harvey Moldavsky. He comes to my poster. He tells me he likes the idea. I never met Harvey Moldavsky. I was quite impressed. He tells me, don't be surprised if you meet people who don't move at night. I said, sure, we have lots of people with fibromyalgia, they don't move at night. I didn't give him the restless leg treatment. He says, don't be surprised if they don't move, but they still have the same EEG abnormality that goes with restlessness. So they're in the sleep laboratory and they have this electrical activity, yet they don't move.
Intrigued, Dr. Holman went back to the lab to look more closely at the sleep patterns of his fibromyalgia patients. He discovered that patients with no outward signs of restlessness oftentimes showed the same disrupted EEG patterns as those who had been diagnosed with restless leg syndrome. At the same time, Dr. Holman came across an article discussing the use of dopamine agonists for the treatment of restless leg syndrome.
The new dopamine agonists for Parkinson's disease that affect the dopamine 3 receptor are the most effective treatment ever found for restless leg syndrome. So we took the idea that was encouraged by Moldavsky to look at everybody with fibromyalgia, and we started using dopamine agonists. And after we worked on the dose, we found that they did have a remarkable effect on fibromyalgia, much greater than the previous old-fashioned restless leg medicines we were using. Now we use dopamine agonists as first-line treatment.
In support of the dopamine theory, Dr. Holman went on to complete a controlled study of pramipexole in the treatment of fibromyalgia. A study that demonstrated this drug to be effective in the treatment of pain and other symptoms associated with fibromyalgia. Although there is much to be hopeful about, there are also some additional issues to consider. The experience of chronic pain is not limited to fibromyalgia. Here are 4 common causes of widespread pain that should also be considered when talking about fibromyalgia. Intermittent cervical cord compression can cause chronic widespread pain that is virtually indistinguishable from fibromyalgia. Just as your brain uses dopamine to process painful signals arriving from the body, it also sends pain-killing signals to the body by way of the spinal cord. In order to do this, the spinal cord must be in good working order.
If the patient, for example, has a history of neck injury, or if they find that when they're in situations where they have to extend their neck, for example, getting their hair done or at the dentist's office, that may be an indication that they have a problem with their cervical spine.
There is a simple test that you can do at home to help determine this. Simply lay on your back on a comfortable surface and look up, that is, hyperextend your neck. If your symptoms of pain worsen in this position, then talk to a doctor. You might benefit from a procedure called a dynamic MRI, in which images of the spinal cord are obtained with your neck both flexed and extended. If you do have a narrowing of the cervical spine, it may be amenable to a form of physical therapy known as craniosacral therapy. You will need to find a qualified practitioner. In extreme cases, the condition may be amenable to surgical intervention.
What's interesting about the neck is that it not only activates the brainstem, which then starts the cascade of sleep disturbance that leads to fatigue and spasm and pain of fibromyalgia, it can mimic fibromyalgia too. Now that adds a level of complexity that most clinicians aren't ready for, but it's very important to understand this. If I see a patient who has global pain, aching, fatigue, poor sleep, the whole package, then I examine them and I don't find tender points as dramatic as I expected, it's almost always the cervical spine. and that plays the primary role in the entire pain syndrome that they have.
Another painful condition called polymyalgia rheumatica, or PMR, may exist. Polymyalgia rheumatica is an autoimmune disease that generally affects people over the age of 50. Although PMR and fibromyalgia are completely different disorders, the pain and stiffness that patients describe is often eerily similar.
You have two disorders that are very similar in terms of the patient's perception and description of their pain and stiffness, but patients with PMR are generally not tender, and they're older, and they often have an elevated sedimentation rate or C-reactive protein that can help clue you in that there's an autoimmune disease.
Although typically detected by blood testing, as many as 25% of cases are seronegative, meaning their blood tests look normal. A qualified healthcare provider can help to determine if this condition is present. The good news is that this is a highly treatable disorder which responds to steroids. It is critically important to determine whether you have a condition called obstructive sleep apnea, in which a person's airway becomes cut off during times of sleep. To determine whether you have obstructive sleep apnea, you will need to undergo a study called a polysomnogram, in which your breathing and brain activity are monitored while you sleep.
The regular, usual risk factors for sleep apnea, you can throw them out the window. We have patients 90 pounds, soaking wet, don't snore, aren't sleepy, have severe sleep apnea. So those individuals who are larger, perhaps, snore, have all the risk factors, they should have a sleep study. No one's going to argue with that. But we get a sleep study on almost everyone now, and we're not at all surprised anymore of what we find.
Untreated sleep apnea can make it virtually impossible to treat the symptoms of fibromyalgia. And the good news is that once sleep apnea is effectively treated, the patient may feel a whole lot better anyway.
Finally, subtle metabolic changes can cause pain as well. For example, there is evidence that a form of hypothyroidism may exist in which a patient becomes resistant to their own thyroid hormone, in much the same way that diabetics are resistant to insulin. Signs of low thyroid include pain, low body temperature, constipation, and slowed thinking, all of which may also go along with fibromyalgia. If you suffer from chronic pain and find yourself identifying with any of the 4 common causes described here, please follow up with your physician or caregiver to see if at least some of your pain might be attributable to one of these causes.
The study of fibromyalgia is doing so much to uncover new areas of human physiology, it's almost unfathomable. All those individuals who never wanted to see those patients with fibromyalgia, who never wanted to get in and battle this incredible disorder, are missing out. They'll catch up after this research is explained by basic scientists like Patrick Wood and others.
The National Fibromyalgia Association is an organization that is dedicated to helping people with fibromyalgia. Unfortunately, not everything works the same for every individual. But what we're here for is fighting for new treatment options, new research, new ideas, and new awareness. And we know that with the help of people like Dr. Wood and other physicians that will be able to happen in the future.
Being in research and seeing the advances that are being made, knowing that we are standing at the brink of truly understanding this disorder, it's very exciting. Because we have an understanding of the pathology of the disorder, we're going to begin to have treatments that actually address the pathology and possibly even reverse the pathology, the problem causing the symptoms, and not just treat the symptoms.
The research to me is like a light. It means hope to me. It means an escape from the prison of pain that I've been in for so long.
I'm excited to know that there is definite cause and it's not just being thought of as a muscular thing where somebody's not taking the right care of their, doing what they're supposed to do with their muscles, or they're over-exercising, or you're giving into this or you're giving into that. I think it's very refreshing.
The brain is an organ just like any of the other organs, and things can go wrong with it, just like it can go wrong with the pancreas or the liver. So that's the way I see it. It's a biological organ, and there's something biologically wrong, and it's okay. There's research and there's hope.
is not only hope for me, but it's hope for the millions of others who have fibromyalgia as well.